Hey everybody, Forrest back with you from Life Assist, clinical product specialist and licensed paramedic. And today we are going to talk about pharmacology, okay? So what is pharmacology? The definition of pharmacology is the study of medications, drugs, whatever you want to call them, their ingredients, how they're prepared, how they're given, and the effects that they have on the body, okay? So why is pharmacology important in EMS? Well, the reason is because when 911 is called and EMS is dispatched, if we're going to provide medications, usually it's for a condition that needs immediate attention and drugs that are going to give quick results. So what I kind of mean by that is we don't go to people's houses and give them 2 Advil and then sit around for 30 minutes and wait to see if their headache's gone. We're there to take care of an immediate need that needs to get results like that, okay? So that's why it's very important. What are some common EMS meds that we use? Just gonna go over a few. There's a lot that we use, but I would say more often than not, off the top of my head, in my career, I used normal saline all the time. So we're just talking normal saline bag, people that have low blood pressure, people that are dehydrated from throwing up, or maybe they've got really bad diarrhea, sick. We're gonna get them kind of back up to where they need to be fluid-wise. Another one is going to be epinephrine. Epinephrine is used in 2 different types depending on the dilution. One is for cardiac arrest, the other one is for severe allergic reactions. Dextrose, D50, sugar, lots of diabetics out there, lots of cases of low blood sugar. This is a medication we give all the time to get people's blood sugar back up to normal. Albuterol, respiratory conditions, breathing conditions, all the time. A lot of people have respiratory conditions. This medication is used frequently. Fentanyl, pain, right? A lot of people break things and they need immediate relief. Fentanyl is going to be your go-to for that. And then, unfortunately, tons of a big opiate crisis we got going on, so we're using a lot of Narcan, right? That's to reverse the effects of opiates for overdoses. Okay, so those are just a few common ones. What kind of forms do all these different meds come in? Well, they come in a lot of forms. So let's just go over some basic ones. We got liquids, we got pills, pastes, powder. We've got liquids that turn into like a mist. We've got gel. We've got patches with medication in them. All kinds of different ways to give these meds, and all different ways they kind of absorb into the body. So with that said, how are we administering them? Commonly, you've probably heard IV, intravenous, through the vein, right? IM, intramuscular, where we put a needle directly into the muscle. Then you've got IO, which is getting more popular, intraosseous. That's where we're introducing medications into the bone marrow, and then from there it gets into the bloodstream. PO, which is oral, so that's just your basic taking a couple pills. Intranasal, which is going to be your nasal inhalants, or like Narcan now, intranasal is pretty popular. And then SL and SQ, sublingual, under the tongue, and then SQ is subcutaneous, which is just underneath like the first layer of your skin, okay? A lot of different routes, a lot of different ways, a lot of different effects as far as how quick these meds work. Packaging. Let's talk about packaging real quick. How are these meds packaged and ready to go for you to use? Very common, vial, right? We got vials, we use empty syringes and needles, we drop the meds. Another one that is really commonly used are what are called preloads. Okay, so when it comes to pharmaceuticals, one of our most popular, frequently asked questions has to do with preloaded syringes and what the difference is between a Life Shield syringe and a Luer Jet syringe. So I'm gonna go ahead and demonstrate step by step, and we're gonna show you the difference. Okay, so the only real difference here is, let me show you. We got the Luer Jet, right? When you pop the cap off to administer it, it is a needleless port. It's got a Luer connector. So if you had your extension set and you kept it like this, you would only be able to connect it via the microclave Luer lock connector, okay? Now, if you really wanted to, you could add like a needle to this, an IM needle, but most people, if they buy it like this, that's how they want to inject it, okay? So, Life Shield, same setup, same way, except now instead of just having the Luer, so you see I unscrew this yellow piece and I've got the same type of connection as the Luer Jet. But if you want to also have the option of a needle, you pull off the green piece and now we've got a needle here. So if you had an extension set that not only had the Luer connector but also had a soft port, you could plug it right in and administer it that way. At the end of the day, very, very similar, just this one has a couple options of how to administer and this one really only has one unless you want to add a piece to it, okay? Alrighty, thanks. Now a preload, there's a couple different types, but basically it's two pieces usually, medication in the side, empty syringe in the other. You pop these tops off, you screw them together, and then up here, which is cool, is this one is called the Life Shield. Connector, okay? So those are pretty cool. Another preload, which is a little simpler, which is just one piece, is called the Answer syringe. Again, medication preloaded. You literally unscrew it and hook it up and deliver. IV bags, I don't need to say much here, right? Administration set, hooks into the IV, drip it on in. Okay, what are these? Ampules. These are kind of like, what? These are kind of old school, right? But these are still used, not as common, but basically it's a glass vial with medication and you break the top off, right? And then you again draw up meds with your empty syringe. Auto injectors, EpiPens, just the term says it all. You push it into the skin and it spring releases a needle with medication and delivers that way. Then we've got, for our respiratory conditions mostly, these are called pillows or bullets. And these basically are, they come in packs, you tear off the pack, you squeeze the medication into the little acorn thing, and then it mists the medication and delivers it that way. Well, I know you know what these are. These are pills, we swallow these. These are also pills, but these are what are called blister packs. Blister packs are kind of pills singularly encapsulated in a foil, and you push the pill out and take it that way. It's the same thing, it's just a different way it's packaged. Then we've got paste or gel. These are for patients that usually are going to take something orally, and you literally just unscrew the top and squeeze the medication or the gel into your mouth. Works pretty good. And then this is an inhaler. This is going to give you kind of a mist or a spray type med. So this is usually used for inhaling. And then finally, this is a unit dose cup. And believe it or not, it's a little teeny cup of medication. It's liquid. Open it up, drink it, good to go. Yes, that was a lot of stuff. Okay, so wanted you to keep in mind a couple things about meds that can be tricky. All these medications and all the different names, they both have generic and brand names, okay? So if your customer gives you a name of a med and you're like, well, I've never even heard of that. We are, on my reference doc, I attached a spreadsheet that our other clinical product specialist, Dave, made, and it's got a lot of the common medications that have not only their generic name, but their brand name. So you can cross-reference to see if you can find it there. If you're also having trouble and you don't find it that way, ask your customer if the medication, if they have an NDC number. It's called a National Drug Code. It's a universal number that all drugs have, and if you have that number, chances are we're going to be able to find it, okay? All right, so we're going to kind of move on into a different realm of medications. I'm going to talk about what are called controlled substances, right? Narcotics, controlled substances, scheduled drugs, they all kind of go hand in hand. This is a different type of drug, okay? These have a lot more requirements in order to purchase. Now, Life Assist, we do not stock controlled substances. We buy them from pharmacies and they are drop shipped, okay? So let's kind of talk about what a controlled substance is. Well, it is, in EMS, typically it's used for moderate to severe pain, so a lot of opiates, a lot of narcotics. And then there's drugs that treat people that have uncontrolled seizures or actually that have mental health issues that we cannot control and we have to chemically sedate them, okay? Controlled substances are laid out in schedules, Schedule 1 through 5. I'm not going to go into each one. On the reference docket, I'll tell you what they're for, but Schedule 1 is illegal, okay? That's like all your illegal drugs. There's no therapeutic value for them. They're not used in medicine in any way. Life Assist sells 2 through 5. Couple of the more popular ones is going to be Schedule 2, right, which is fentanyl. Fentanyl is a Schedule 2. That's a pain medication. We do offer that. Schedule 3, an example, would be ketamine. That's another pain medication, and we offer that as well. And then a Schedule 4 drug is going to be your midazolam or your Versed, and that's for the seizures or the behavioral problems. Now, how can you get these drugs? How can you get any drugs? Okay, first things first. In order to purchase pharmaceuticals from Life Assist that require an RX, require a prescription, you have to fill out a prescription authorization form, okay? That'll get you the RX drugs. Now, if you're moving into controlled substances, you have to have secondary on top of that, what is called a DEA license, Drug Enforcement Agency license, okay? That's for any controlled drug. And just to add to that, if you want to purchase Schedule 2 drugs, you also have to have what's called a 222 form, and that is for Schedule 2 drugs only. Now, want to make clear that because we sell prescription medications, we do not sell to the public from your local doctor who wrote you a script to come in and fill it at Life Assist, because we're not a pharmacy. Okay, so I just want to keep that in mind. Believe it or not, we've had customers come in with prescriptions asking to get them filled. So we do not offer that service. Okay. So that's pretty much how the drug works. Now, we also do sell over-the-counter drugs as well. That don't need prescriptions, but of course, you're going to need to have an account with Life Assist in order to purchase those as well. Okay, last couple things I wanted to go over is that what sets Life Assist apart from a lot of our other medical equipment suppliers? Well, number one, we are one of the few companies that sell to all 50 states, okay? There is a lot of licensure and a lot of hoops and a lot of forms and a lot of upkeeping to keep this going. A lot of medical supply companies do not offer pharmaceuticals or drugs of any kind because they don't want to go through the licensure, okay? So that is huge for us. That sets us apart in a very big way. Okay? All right. Well, I think I covered most of it. I do want to let you know that the reference doc that I created on this one has got tons of hyperlinks to photos of all the different drugs that we carry, all the different forms you need to fill out, all kinds of reference material. So if you're a customer or if you have a question, I'm sure the answer might be in there. If not, you can always give us a call. All right, you guys. Thanks for watching. We'll see you on the next video. Take it easy.